The parents of a Butte man who recently died from a fentanyl overdose here in a trailer on this property are furious, and they're demanding to know why overdose rates continue to plague the mining city after years of record high death rates.
This is the hoodie he was wearing. It's the closest I get to be with him. That first second before you wake up, before your eyes open, you're awake, but your eyes aren't open. You get sort of a smile inside because you think, oh, I just dropped that. That was a nightmare.
Heather Holland and her daughter are getting tattoos to memorialize Aaron MacArthur, who died from a fentanyl overdose in September. Heather says every morning when she wakes, she experiences the soul-shattering realization that the death of her 33-year-old son is not a dream, and she becomes angry.
I'm mad. I'm sitting here and I'm sad, but I'm mad now. These people need help. These families need help.
Aaron battled addiction for years. He spent time in a rehab facility, but his family says he was caught up in a vicious cycle of addiction. Before his death, he had been clean 9 days, but Heather says finding help to treat his addiction was impossible.
5 people overdosed the night my son overdosed. 2 of those died, and 1 was my son.
My middle name's Millions, baby.
Aaron called him Tai Tai, and I got him 2 days after Aaron's passing, and he chipped away a little bit of the blackness in my heart.
Mark MacArthur walks Aaron's dog Titus by the property where his son died and recounts the last days he saw him. Aaron was pale and sweating. Mark says he was in severe pain from withdrawals.
I begged him to get in that van. His dog did, and he was so ill, and I just couldn't get him there.
1 year ago, Aaron was one of 6 people who experienced fentanyl overdose and was saved by Narcan, a drug that reverses the overdose. Butte Silverbow initiated distribution of the drug and began providing training classes for the community.
Hey, I'm going to give you another dose.
That's where I met Aaron's grandmother, Mary, who was taking the class after Aaron and another grandchild overdosed.
It's ruining lives, and we've lost a lot in this community. And we've saved a lot Narcanning them, but then you can only do it if you're there.
Since January 2025, Butte Silverbow Health Department reports that they have trained 64 people to administer Narcan. They also have distributed 1,400 boxes of the drug. The state also announced earlier this year that it would spend $400,000 on naloxone kiosks, but Butte does not have a kiosk. Mary says Narcan administration saves lives, but it's not a total solution.
I was researching, I was calling people, I was beating doors down just to find help, and I wasn't finding any.
I think no door should be closed. When parents, loved ones are trying to find out what's out there for our loved ones to get help, let's make it easy.
State data indicates that overdose deaths in Butte are higher than the state and even national averages. And while Montana has invested massive amounts of money for initiatives meant to help addicts, Heather and Mark wonder why the services aren't reaching those who need it in the mining city.
I don't want anybody to have to go through this again, and I want those that are doing drugs to have an avenue that they aren't afraid they're going to go to jail. If you want help,
Heather is working to form a support group for families who experience loss due to addiction and suicide, and it carries her son's nickname. For more information about the group, head to our website. In Butte, Megan Thompson, MTN News.